and health coaches. Welcome, Dr. J.
Thank you, everyone. Thank you, thank you. Here's the family. Some of you guys I've met my wife because she is my office manager, so that way I can't get in trouble. So there is today by the end of this presentation, my goal is for you guys to understand why I become a chiropractor, why you should refer your friend and family without any hesitation, and my goal for Simpi. So let's start by why did I get into why did I get into chiropractic? I did when I was in high school. I got involved in a major. I got a 10 all around. I got into a major auto accident, and right on 31st Street, and a car T-boned me. A truck T-boned me. I hit a pole, and I woke up at Bayfront 3 hours later with a severe post-traumatic headache. Then I went to see a chiropractor. The way he treated me, not only he treated me with respect, but he showed me that he actually truly cared. So I wanted to return the favor. Then I went to USF for biomedical science, and then after that, I transferred to Parker Chiropractic in Dallas, where I graduated with a bachelor degree in health and wellness, a bachelor degree in anatomy, and a doctorate degree in chiropractic. Then I started, and when I started, I was under the assumption chiropractic is always about auto accident. You get into an accident, you go to see a chiropractor. That's what majority of us have heard, and that's what when I was growing up here, that's all I knew until I got into chiropractic. So when you look at the spine, I'm gonna change it just a little bit. Of course, he told me the way to go, and I went the opposite way. So when you look at the spine, this actually, the one on the left, it's actually one of my patients that came into the office, and on the right, it's a normal spine. Which spine would anybody would have? Right, the one on the right makes sense, right? Now let me ask, if I ought to ask a question, how many of you guys that have not taken an X-ray of your spine? Right. So and I'm not saying that to point it out. It's just to say that this is how we live because we don't see your spine, right? Out of sight, out of mind, right? So what happened is that when we do throughout our life, we at a young age we start playing sports, we become very active, correct? So there are injuries that occur, and then let's say we play sports. Majority of the time they said, "Hey, get back in the game," right? We hear that a lot of time, and I have a lot of sports athletes that come to my office, so I see that a lot. Where when you take the X-ray, you take the X-ray, and that's what you see. Now this patient never plays sports, right? Why does the spine become that way? What happened is that most likely there may be an injury when she was little, right? Maybe a bad fall that they never really take care of, and then over time the body started compensating. If you're having problem with on your left side, the first thing we're going to do, we're going to lean to the right, right? Because if I go to the left, it hurts. So over time, we just deal with it. We say, "I'm okay, I'm fine," as long as it doesn't prevent us from as long as it doesn't prevent us from doing what we normally do. Guess what we do? We fine. But over time, it starts getting worse because it did not come that way on one day. It would then come that way from just a neck discomfort. It's something that happened, or sometimes you're involved in an accident at a young age, or when you're in the car with your parents, and you never actually had it taken care of. So now over time, it become an issue. I've seen so many patients with with those kind of injury. Now, let me ask you a question. Do you think I'm just gonna go ahead and adjust this patient by hand? No. So this is why I tell patient, never, I don't care who you go see, do not, if you decide to go see a chiropractor, do not go see anybody that's not willing to take an X-ray of your spine. Because they don't know what you did, what happened to you. Everybody that comes to the office, there is a reason you come to my office, right? So for me to find out what's going on, I'll get to the bottom of it. So we do a thorough exam. I'll ask you questions even when you are little. Started from ear infection and up. So the reason why I do that is because I want to know what's going on, what I can do to better help you. So if I don't know what's going on, how can I truly help you? So once I get the X-ray, then I go over the X-ray with you. So that way we both understand what's going on. And then when I make my treatment plan, that my treatment plan start making sense to you. Because if I just have you come in and I adjust you and just send you on your way, I'm not really explaining anything to you, right? So my goal is that if I pick any of my patients that may be in here and said, "Hey, did I explain everything to you?" I hope everybody said yes. So, but that's the whole goal. Whenever you go to wherever you go to a doctor, you want them to actually go to the detail of what's going on with you, because the focus is supposed to be on you. So once we get that, I have a three ways of treatment. The first way is basically to get you out of the pain phase. Usually, based on the injury, it may take 2 to 3 weeks. And then once I get you out of the pain phase, my next goal is to actually work on the muscle. Why do we work on the muscles? Because we have two sides. Whenever there's an injury, one side become extremely tight while the other side become extremely weak. What happens is that the weak side, right? The weak side is constantly getting pulled, right? While the side just keep pulling it. So our goal is to actually stretch the side that's extremely tight, and then strengthen the weak side to prevent this from happening. So as we do so, once I get you to the stage where I feel like you're more balanced, your posture is better, then we start strengthening. We start doing strengthening exercise. Why do we do strengthening exercise? It's to keep you from coming back to me with the same pain, right? Because if we do the exercise, of course I have my patient do the exercise at home. 90% of the time, because the way I work is that if you're feeling well, the less time you have to see me. Because I don't want you to come see me for pain. I want you to come see me for wellness, right? So prevent you from going to that stage. So by doing that, the more we do so, the better it feels. And I'm going to pass a few things around. This is called an activator. This is what I use to treat that patient because I cannot adjust them because of what's going on. The activator, where I'm not putting too much pressure on the patient, make it the adjustment a little bit easier, where I'm not hurting the patient. You can go ahead and pass that out, and all you have to do is just push this. Okay. Yeah. So, and then you can pass that out. This is the spine. You constantly hear about herniated disc and bulging disc. This is a bulging disc. This is where you take when you take an MRI. When you look at the MRI, you see it bulging into the nerve and pinching the nerve. And then you have the herniated disc. Now, it's not only pinching the nerve; it's also pinching the spinal cord, which can cause numbness and tingling down the legs. Okay. So now, what are the good referrals for me? Let me go. As you know, I work with a lot of attorneys that are PI attorneys. I work with, let me see, PI. Oops, I went too far. I work with a lot of PI. I work with a lot of PI attorneys. I work with a lot of massage therapists. The Dr. Mara, acupuncturist. We work very well together. So, and we're also part of the veteran group where we actually help veterans to get treatment without paying a dime out of their pocket. So if you know anyone that actually can use my help, and this is what I want to make sure is that what makes me different is the fact that I take my time with my patient. I get them where they need to be because it's a goal for us to reach the goal, right? Well, I guess I'm running out of time. Dr. J here, helping as many people as possible.